Welcome to Module 2, Grief and Issues Specific to Perinatal Loss and Possible Comorbid Diagnoses. Bereavement issues specific to perinatal loss. Any perinatal loss, any pregnancy loss, especially stillbirth and infant death, are definitely a disruption of significant life milestones. We can feel isolated from our peers and family. We will have an existential crisis of why me. We will wonder compulsively over all the details of what just happened. We need to find sense out of the senseless, but there is no sense. There's not going to be any sort of satisfying answer as to why this woman's baby died. It's really disruptive also because we all live our lives with an assumption that we know what's going to happen tomorrow. We have some semblance of understanding what our day is going to look like, that the sun comes up and the sun goes down, that we will have our usual, work day and we'll see the certain people, and, if we're in a relationship, we'll be with that person or certainly be talking to that person. So our assumptive world has just been blown up when a baby dies. Everything we held to believe true and in order has just been completely been thrown out of order. We grow up in our society to believe that you have sex, you get pregnant, you have a baby, not, you have sex, you get pregnant, and your baby dies. So a lot of difficulty in reorganizing who am I now? What is my self-identity? This woman will never, her and her partner will never be the same person they were prior to this pregnancy. And forever, any subsequent pregnancy will be fraught with a lot of anxiety and worry and a loss of innocence and naivete. Often the stages of dying get confused with grief. There are no stages in grief. Grief will come and go like a wave. I'm sure many of you have heard that. At times, it will seem like you're riding these horrible waves of grief and sadness and despair, and it's never ending. And then before you know it, the waves start to get a little softer and a little less tumultuous. So that is how grief typically will go for most people. It will soften over time, but that baby will always be loved and missed. This is one of my favorite illustrations of grief because there is no timeline. There are absolutely, certain common feelings and emotions and experiences of grief that we all share as a human race. But we definitely do not go through these feelings in a certain order, and nor do we, once we get through, the shock, the anger, and the fear, anger and fear can always come back, especially in birth trauma, where it's also complicated by PTSD or post-traumatic stress symptoms. Just keeping that in mind is, I think, incredibly helpful. So what is grief? Grief includes many different feelings and processes. It's a very complex question, and it's also a very complex set of feelings and emotions one goes through, generally and almost always associated with the death of another human being. Although we know in our lives, grief can encompass so many different experiences in our life. It could be loss of a dream, loss of a relationship, loss of a job, etc., etc. Grief here is also about all the different processes one goes through. There's going to be shock, denial, there's bottomless pain, there's numbness, there's fear, guilt, shame, betrayal, extreme liberation, and or joy sometimes. Sometimes if someone has died that was not well mentally and was draining your finances and your attention, it's not uncommon for one to feel a sense of relief after someone has died, which of course makes you feel a little guilty. But nonetheless, it's not uncommon, and nor should it be pathologized or seen as weird. But back to pregnancy loss and stillbirth, grief can unravel a long thread of internal wounds linked to many life circumstances. And I call death a portal to any other feelings and experiences that feel familiar to the event that just took place. It's complicated and not always conscious. There are subtleties and complex unconscious experiences that can come to the surface when someone we love dies. Often people aren't ready to meet and hold the vast breadth of this process, and it will bring up so many different range of thoughts and emotions and ruminations that a person just wouldn't even think maybe would ever enter their mind, or certainly go over and over certain things so much. So grief is painful, incredibly painful, and many people don't want to feel it. So people try to avoid it, no doubt about it, and can be shoved away or put in a box or hidden with a mask on your face. Like everything's fine, but inside everything's not fine. And often we can banish all these feelings to a bottom of a well and think that we're okay for a while, which you might be, but it's still there. And oftentimes people will push away their feelings of grief or feeling like it's okay to have their feelings come and go, because society often doesn't know what to do with you, doesn't know how to treat you, how to respond to you, how to support you with this very invisible loss. It's not a broken arm, it's not cancer, it's not the death of a grandfather, it's the death of a baby or a pregnancy, and people just are not comfortable with it. In fact, your client or your patient will often feel like they might be taking care of other people's emotions if they were to bring up the pain and the missing of their baby. Often also, bereaved moms and parents do not have social support. And social support has been shown to be the number one thing to help grieving families and grieving women get through such sad times in their life, a tragic time. And also, to add to that, sometimes the bereaved are made to feel as if they've grieved long enough and should be over it by now. Often you'll get the platitudes of, oh, let's just wipe the slate clean and you can have another one, as if you lost your wallet or, it's something that's easily replaced. So again, feeling like there aren't a lot of places for you to share your pain and grief is certainly sad in our culture. There are atypical grief reactions, certainly warning signs in our grieving to look out for. If a person's general daily functioning does not return after 4 to 6 weeks, you're probably looking at a much more complicated grief and or a major depressive episode. So we may absolutely need to pay attention to that and may need not only a psychological evaluation, but a psychiatric evaluation. Persistently re-experiencing a traumatic event over and over again with flashbacks. Well, that's PTSD, and that's harder to treat, but completely normal. So it's important that you know some cognitive behavioral techniques to offer your patient or client in order to help them with those flashbacks. Insomnia due to increased arousal, absolutely. Death makes us feel like we're on high alert. Our amygdala in our brain is lit up, saying danger, danger, danger all the time. Grief and trauma makes our worlds really small. You will find that your patient or client will only feel comfortable going from A to B to C daily. And rarely wants to go outside that comfort zone because they feel out of control. Suicidal ideation is high, so that needs to be addressed. And emotional numbing, feelings of detachment, absolutely. Nothing like the death of a baby will make you feel more detached and like you're not part of the human race. Like you are having some sort of experience that no one else can relate to. Possible comorbid diagnoses with perinatal loss. PTSD, according to the DSM-4 TR, is when the person has experienced, witnessed, or was confronted with an event or events that involved actual or threatened death or serious injury, or a threat to the physical integrity of the self and others, and the person's response involved fear, helplessness, or horror. That describes birthing death perfectly. Birthing your dead baby is absolutely a birth trauma and needs to be addressed. Incidence, correlates, and predictors of post-traumatic stress disorder in the pregnancy after stillbirth are completely there. And women are vulnerable to PTSD in pregnancy subsequent to stillbirth, particularly when conception occurs soon after the loss. So often many women will want to try again and will become pregnant quite quickly after the loss of their baby. And the terminology for that is called a rainbow baby. When a woman gets pregnant and has a baby within almost the same year to the date of the death of the previous child. And she will not have a comfortable or fear-free pregnancy. It is often fraught with a lot of anxiety, stress, and fear. Post-traumatic stress disorder is a disorder that can develop following a traumatic event that threatens your safety or makes you feel helpless, as I mentioned earlier. Most people associate PTSD with military combat and war veterans, and it is the most common cause in men coming back from war. It is also associated with car accidents and violent assaults. But any overwhelming life experience can trigger PTSD, such as birth trauma, stillbirth, and infant death, especially if the event is perceived as unpredictable and uncontrollable. PTSD can affect those who either personally experience the trauma or catastrophe, those who witness it, and those who pick up the pieces afterwards, including emergency workers and law enforcement officers. It can even occur in the friends or family members of those who witness the trauma. The traumatic event or events that lead to post-traumatic stress disorder are usually so overwhelming and frightening that they would upset anyone. When your sense of safety and trust are shattered, it's normal to feel crazy, disconnected, or numb, and most people do. The only difference between people who go on to develop PTSD and those who don't is how they cope with the trauma. After a traumatic experience, the mind and the body are in shock. But as you start to make sense of what happened and process the emotions, as you come out of shock, that's when you'll know how much the PTSD is affecting your daily life. The PTSD, however, remains in your central nervous system. So this is where it's tricky to treat and can become insidious because anything can trigger a PTSD emotion, feeling, a panic attack, heart pounding and racing. And so it can become tricky to know what those triggers are if they're not obvious. Post-traumatic stress disorder continuing. These are all common symptoms women disclose for having a birth trauma. Good to just remind yourself that these are normal for your patient or client to be having. However, they are, of course, uncomfortable and scary, and they just want relief from all of these symptoms. Here's some more that I wanted to share with you all. I use a PTSD checklist in my practice. It's the civilian version of a PTSD checklist called the PCL-C. You can Google it, and it's in the public domain, or you can email me and I can help you get a copy if you're having trouble finding it. But I find it really helpful, and it also is good to be able to show your patient the symptoms they're experiencing, and that they're not made up in their head and they're not going crazy, because a lot of times they just want validation and understanding and compassion for what they're feeling and going through. I know this is a lot of text, but hoping you can, come back to it if you want, but read it over. I wanted to give you some helpful ideas on how to help your patient or client with the distress they may be feeling, and the advice and tips to give them when they need help and don't know what else to do. And these are all very good techniques and tools for their quote-unquote emotional toolbox, as I call it. But this helps them realize that they have control of the situation and of their body, and that's the main thing you really want to help them with, that they need to check in with reality, look around, literally the room, and see, is that happening to me now? No. Am I safe right now? Yes. So to just reconfirm that the reality in the moment, getting present, is really important. Really, really important with PTSD. Perinatal loss is a risk factor for future and multiple mental health stressors. As I've said before, any future pregnancy as they move through their lives, daily living. It's fraught with all sorts of different symptoms that should soften over time. And it all depends on who they are as a person, what their trauma history is, how they handle stressful situations. Personality and temperament definitely come into play with this. We know that mothers who experience a stillbirth are at a higher risk of developing postpartum mood and a possible stress disorder. So just to also keep evaluating them for postpartum and along with the grief and the PTSD. Postpartum is at the highest risk with symptoms after 6 months of delivering. Mothers who experience a stillbirth are at a higher risk of developing a postpartum mood and anxiety disorder, especially mothers who don't show any symptoms of grief during the first 2 weeks after the stillbirth, who seem shut down emotionally, who seem really disconnected with reality. We want to look for psychosis. We want to be on high alert for suicidality. We really want to be highly monitoring these women. And the highest risk for postpartum, in addition to the birth trauma, is within the first 6 months after delivery. However, we all also know that postpartum mood and anxiety disorders are diagnosed after 2 weeks if symptoms do not abate. So it's a tricky mental health picture, but you want to normalize symptoms while at the same time monitor for the extreme symptoms that keep them from being able to get out of bed, return to work after about 6 weeks, 4 to 6 weeks, whatever their bereavement leave might be, difficulty eating and sleeping, and relationship issues and being social. And if they have prior children, just how is that relationship going, and keeping an eye on that as well. I like this quote from Dr. Shoshana Bennett. She's the former president of Postpartum Support International. And so I put it up for you to read. Basically what she's saying is that often therapists miss a lot of symptoms after perinatal loss by only addressing grief. And there's also brain chemical changes in the women due to the ending of a pregnancy, and the woman's body doesn't know if there's a live baby or not. All it can tell is that the pregnancy is over, and that triggers biochemical changes, which also can complicate the picture with a postpartum mood and anxiety disorder. So the point is that both the psychological and the biochemical pieces need to be explored and treated as necessary. Some statistics on mothers and grief. More intense grief reactions are seen in the sudden death of a child, in contrast with those mothers whose children die as a result of a chronic condition such as cancer. Thoughts of suicide are not unusual in the aftermath of a stillbirth. 30% of mothers reported having such feelings. 20% of mothers who've experienced a stillbirth experience a prolonged episode of depression, and 1 in 5 mothers suffer from PTSD, not surprisingly. So this concludes Module 2 on grief and issues specific to perinatal loss and possible comorbid diagnoses. As you can see and hear, perinatal loss presents a very complicated mental health picture, including physical, emotional, and spiritual issues. The important takeaway is to address the most distressing symptoms first, and to get your client or patient to access their capacity for reflection on their thoughts and feelings, as well as to have techniques and support in place for when symptoms interfere with daily living. Please continue on to Module 3 on preparing for the birth.